Breath stacking helps maintain lung capacity over time and helps prevent the lungs from getting smaller faster as one ages. Also, when used in conjunction with the assisted cough technique, breath stacking helps lungs build enough volume to provoke a productive cough, expelling mucus. Before you begin, if you or the person you're assisting is sick or susceptible to infection, consider using personal protective equipment, or PPE. However, in a hospital setting, whether you are infected or not, breath stacking requires wearing full PPE. In the home, we suggest you wear a mask and gloves if you have an infection. If you have paid attendants, they should always follow their organizational guidelines. To start, you'll sit upright and get comfortable. If needed, put on a nose clip to help keep the air in your lungs. Then place the mouthpiece in your mouth, holding it with your teeth and making a tight seal with your lips. Take a deep breath and hold it. With air in your lungs, try to breathe in more air as the LVR bag is squeezed gently. This will push extra air into your lungs and help them stretch. The bag should be squeezed gently 2 to 5 times until your lungs are completely full. Your lungs are full when the bag gets harder to squeeze. Remember, if you feel too full, open your mouth and exhale. Once the lungs are full, release the mouthpiece and cough. Repeat this process 3 to 5 times. You can do more if you still have mucus to clear. Take a break if you get tired, dizzy, or lightheaded. For your last 2 breath stacks, you can try to hold your breath for 3 to 5 seconds before releasing the air.
And now just hold your breath, let it out. 1.
Don't hold your breath
2,
if it makes you dizzy,
3,
particularly if you're
4,
sitting up.
5, and a slow release.
Release your breath slowly.
That's great. Did that make you dizzy, or is it okay? That's good. Yeah. All right. So we end it like that, just so that you're not ending on that cough note.
So, why would you want a breath stack? For lung health and strength, breath stacking stretches out the chest wall and lungs and helps keep chest muscles loose. It also helps get air down deep into your lower lungs to help get oxygen to those hard-to-reach lower air sacs. This helps maintain lung capacity over time and helps prevent the lungs from getting smaller faster as we age. Also, when used in conjunction with the assisted cough technique, breath stacking helps lungs build enough volume to provoke a productive cough, which expels mucus. We all produce about half a cup of mucus a day that needs to be cleared from the lungs naturally, using little hairs in the lungs called cilia. Deep breaths are part of helping with this process to move the mucus up and out towards the mouth, where it gets swallowed naturally, often without us even knowing it. Breath stacking can also be used to help increase a person's voice strength. It's worth noting, breath stacking with a manual resuscitator, a resuscitation-style bag, is the most effective and accessible LVR technique.
So, when should you use the breath stacking and assisted cough techniques? To keep your lungs healthy, breath stacking with assisted cough should be done 2 to 4 times a day. Your respiratory therapist will set up a care plan that best suits your needs. In times of an infection, breath stacking and assisted cough may be done as often as every 10 minutes. It's best to do LVR breath stacking before meals, but if you can't, wait at least 30 minutes after eating. This will help reduce the risk of nausea and possible vomiting. You can even do your own, or assist with, your breath stacking and assisted cough if you're able to squeeze the bag and apply your own thrust. Finally, the assisted cough, or stomach thrust, may be used at any time to help move mucus. Your respiratory therapist can advise you if routine stomach thrusts should be used.
Do not do breath stacking if you feel lightheaded, feel any chest discomfort, have an upset stomach, or are experiencing low blood pressure. If you think the breath stacking and assisted cough techniques are something you could benefit from, connect with your healthcare team to discuss lung volume testing and how to get the tools and assistance you'll need to get started.